Hi, my name is Hayley Croft, and I am currently located on Awabakal land on Lake Macquarie near Newcastle in New South Wales. I would like to acknowledge the traditional custodians of this land and of country throughout Australia and their continuing connection to land, sea, and community. I pay my respects to them and their cultures and to elders past, present, and emerging. This presentation provides an overview of a suite of workplace-based assessment tools initiated and developed by the Australian Pharmacy Council and supported by the Pharmacy Board of Australia, with a view towards embedding these tools into pharmacy intern training. We do appreciate that preceptors and supervising pharmacists who support interns will have had varying levels of experience in providing evaluation of performance in the workplace, the methodology of the various tools, and the way that they're implemented in practice environments. Therefore, the purpose of this presentation will be to provide an overview of the initial suite of 6 workplace-based assessment tools that have already been developed and trialled. These tools and their associated resources are now available on the APC website for any preceptor and intern to use. Workplace-based assessment, or WPA, refers to a group of assessment methods looking at how an individual performs their role in real-life, day-to-day workplace situations. Using WPA aligns with current trends in health professional education, which support gathering evidence of both clinical competence and professional behaviour as it's observed in the work environment. So the rationale for having more than one type of assessment tool is because the effective assessment of individuals in the workplace requires different strategies to observe performance, and we cannot rely on just one method of assessment to assess all domains of competence. A range of assessment methods that may be used for assessing interns are already described in the Intern Year Assessment Blueprint. And these include methods such as in-training assessments, assessment of entrustable professional activities, and case-based discussions. And these are the key methods that underpin the initial suite of workplace-based assessment tools that have been developed by the APC and will be discussed further here. It should be noted that the purpose of workplace-based assessment is two-pronged in that it serves as both formative, that is having educational and feedback role, as well as summative, which is more about making higher stakes decisions about one's readiness to progress towards the next stage of independent practice. The Performance Outcomes Framework sets out the performance outcomes to be achieved by interns, both as they enter their intern training year, so upon graduation from university, but then again as they apply for their initial general registration. So this framework is intended to be a means of assuring the profession that these individuals have demonstrated the capability to undertake practice to the expected level as they transition towards independent practice during this period. So while some of these performance outcomes can be assessed by means of external point-in-time examinations, such as the written exam and the oral exam, the majority of these are more appropriately assessed in the workplace, and this is done using relevant workplace-based assessment processes. So having a suite of workplace-based assessment tools therefore not only supports interns, preceptors, and intern training providers to collect evidence of intern performance against these performance outcomes, but in doing so, it also provides national consistency and equity in the way that we approach evaluation of performance in the workplace. The initial workplace assessment tools have been developed with funding support from the Pharmacy Board of Australia in a process that has involved ongoing consultation with experts and key stakeholders. So this culminated in a small-scale pilot study at the end of 2021, the preliminary data for which has demonstrated that the implementation of the proposed assessment tools was feasible. The 6 tools which have been developed include 1 case-based discussion, 3 Entrustable professional activity assessment frameworks. So this allows preceptors to assign entrustment levels to pharmacy interns for specific workplace tasks. and 2 in-training assessment activities focused on reflection and health promotion. And I'm now going to talk through the key points for each of these tools. These tools have been designed to address a total of 15 performance outcomes, noting that multiple outcomes can be demonstrated simultaneously using the one assessment tool. Each of the 6 workplace-based tools are supported by a preceptor and intern user guide, and this includes a one-page quick reference guide as well. A feedback and assessment form, which is the part that records the outcomes of the performance activity, as well as additional templates and forms as appropriate to support the implementation of the activity in the workplace. So these resources are all intended to support preceptors and supervising pharmacists who may be communicating regularly with their interns about the role of the tools and also providing guidance for their use. And all of these resources are now available on the APC website. I'll start off by reviewing the case-based discussion tool. As interns participate in their workplace activities, to obtain the greatest benefit from their engagement with the case and the associated critical thinking and problem solving, debriefing with a more senior colleague is important. A case-based discussion, therefore, is a retrospective exploration of a situation in which an intern was actively involved in the provision of care to a patient and/or their carer. In choosing a case to discuss for this activity, it can be facilitated by the following key points. The discussion should occur when the patient interaction has been completed, so not while the patient is still present and interacting with the pharmacist. Ideally, the intern was involved or actively involved in at least some aspects of the case, rather than just being an observer. Although some cases will involve governance issues, legislative and ethical considerations, the case should really be focused on the therapeutic aspects of patient care. The case discussion should also be tailored to the current stage of intern progress, such that the complexity of the cases will therefore change depending on the timing of the activity during the intern year. And while considering the stage of intern progress, the case should also challenge the current point of development to maximise the potential for learning. So therefore, preceptors may choose to alter the complexity of the case by adding in hypothetical changes to the scenario during the discussion. For example, let's assume the patient in this case were a child. And then finally, a variety of cases should be used for each time this assessment activity is completed. This diagram outlines the key steps involved in undertaking a case-based discussion. Firstly, the case to be discussed should be chosen by the supervisor in conjunction with the intern. Once the case is selected, the intern then prepares by pulling together information about the case and is also encouraged to self-reflect on the situation that they were involved in. During a discussion between the intern and the supervisor, the case presentation involves the intern presenting a summary of the key aspects of the case. So this will likely involve a discussion about history taking, follow-up, self-management strategies, the identification and prioritization of medication-related problems, and any recommendations that were made. Once the intern has presented the case, the supervisor then has the opportunity to ask some questions to check understanding. They may also encourage the intern to reflect a little more on their actions and provide the intern with feedback. Strategies that preceptors can use to provide feedback have also been included in the tool for them to consider. The basis for assessment judgments is that of the extent to which the intern meets expectations for their level of experience and stage of internship, or is borderline or below these expectations. Following this assessment, the intern will then develop a plan that outlines the actions for further development. As an approximation, the time allowed for the discussion between the intern and the supervisor should be a minimum of 30 minutes. I'll now provide an overview of Entrustable Professional Activities, or EPAs. EPAs are primarily descriptions of tasks or activities which are undertaken in the workplace. Thinking about health professional training more broadly, health education is really all about trust. We all have a responsibility in the workplace to assist in developing pharmacists who can be trusted to deliver safe and effective care, and in doing so, we make decisions along the way to entrust interns to progress towards unsupervised practice. Entrustment decision making is therefore about deciding how far to trust interns to carry out these tasks or EPAs on their own. The outcome of an entrustment decision is the determination of a level of required supervision, and for practical purposes, a framework of 5 levels of supervision has been proposed. As one moves through the levels from level 1 to level 5, as you can see by the descriptors for each level, there's a progressive increase in autonomy and responsibility of the intern, and a decrease in the level of supervision that is required. As a general guide, it would be expected that for the performance outcomes being assessed, most interns would be level 2 or level 3 on entry to their intern year, with the view to progress to level 4 by the end of their intern year, noting that some individuals may be entrusted earlier. On that point, it's critical to note that even when an intern has been deemed entrustable at level 4, the Pharmacy Board requirements for supervision while the intern is provisionally registered still apply. Entrustment decisions may be considered ad hoc or summative. Ad hoc decisions are those decisions made by supervisors of their trainees continuously in everyday practice. Summative decisions, on the other hand, are more robust decisions about one's readiness to progress to the next level of practice, and these are usually based on information from multiple sources or repeated observations. These multiple sources may be referred to as short practice observations, or SPOs, and SPOs are any form of observation of the intern carrying out the EPA as part of normal professional practice. So it provides an opportunity for the intern to be observed, for them to receive feedback on their current performance, and identify areas for improvement. So in this sense, SPOs act primarily as a formative type assessment. This diagram outlines the key steps involved in undertaking an EPA assessment. So first, deciding on the activity to be undertaken, whether that be medicine dispensing or patient counselling, for example. And then the supervisor observes the intern carrying out this activity from beginning to end, and noting that this could be observation by different people or different supervisors at different time points. The intern then reflects on their performance and receives some feedback from their supervisor. And then for some short practice observations, when it's deemed that the EPA has been carried out consistently and appropriately over a period of time, an entrustment discussion is held and a more summative entrustment decision is made. So this is where the preceptor looks more to future practice to think about how the intern might be able to perform a task with a new level of autonomy, so a new level of responsibility and a lower level of supervision. And following this process, interns are encouraged to use all of the feedback received to create a development plan. So I want to highlight that many preceptors and supervisors would be currently making such decisions in practice, and that EPAs really just provide a structure to support this process. The suite of tools covers a framework for formalising the process of entrustment decision making for 3 key tasks: medicine dispensing, compounding, and patient counselling. Here is an overview of the 3 EPA tools. The first row in the table offers a brief description of the activity, while the second row outlines the key information sources that preceptors can use to assess interns' progress and ultimately ground a summative entrustment decision. EPA 1 is medicine dispensing, and this assesses the intern in their ability to determine the safety and appropriateness of a prescribed medicine, including both the procedural aspects of the task and the clinical reasoning. It's important to note that interns and supervisors must both be clear on the details of the dispensing procedure against which the intern's performance will be compared. In terms of the sources for medicine dispensing, interns are required to keep a dispensing log, which is completed for 10 consecutive prescriptions in a given category, as well as a critical error and near miss log. And preceptors can determine if additional short practice observations are required in addition to this. And templates for documenting these activities are also provided as part of the EPA tool. EPA 2 is compounding pharmaceutical products and preparing them for supply in a way that is consistent with Pharmacy Board of Australia and TGA guidelines. So this EPA is aligned with the documentation that's already required for the 6 products mandated by the Pharmacy Board of Australia, and this forms the basis of entrustment decision making. Preceptors, again, at their discretion, can consider if any additional short practice observations are required for assessing performance. And in the context of hospital pharmacy practice, preparation of batches could be included in these additional short practice observations. EPA 3 is for patient counselling and ensuring patients and carers are provided with accurate and tailored advice on the use of their medicines and the management of their health conditions. For this EPA, it is suggested that 6 short practice observations would be appropriate to inform entrustment decision making, with the opportunity also for the intern to receive feedback from the patient or carer perspective to whom they provided the counselling, and a template is provided to support the collation of this feedback. The final 2 tools are in-training assessments. The purpose of the health promotion tool is to provide interns with structured guidance and templates on which to base the design, implementation and evaluation of a specific health promotion or public health initiative. This diagram outlines the key steps involved in conducting an in-training assessment for health promotion. Firstly, the intern should undertake some form of research into the health or disease demographics of the target audience of the activity. The activity should also involve direct contact with the public and deliver outcomes directly to individuals or groups within the community. In conjunction with their supervisor, the intern should then plan and design the activity from the preparatory stages through to evaluation. When ready to be implemented, the intern should then undertake a significant role in the implementation of their activity, and this may or may not encompass a hands-on involvement, depending on the nature of the initiative. Once the activity is completed, the intern should also take responsibility for evaluating the impact of the activity, which includes a written report and a written reflection. The supervisor can then discuss the activity report and evaluation with the intern and provide feedback to the intern on how they designed, implemented and evaluated the activity. Ultimately, this tool allows interns to be assessed in their ability to contribute to public and preventative health in a manner that is relevant to the needs of their local community. And as such, the assessment rubric requires supervisors to determine the extent to which the intern has demonstrated a number of elements of performance and as to whether these were demonstrated satisfactorily or whether improvement is needed. The purpose of the reflection tool is to assist interns reflect on their experiences in the workplace, exploring them with the perspective of hindsight and trying to learn something new from them. This diagram outlines the key steps involved in conducting an in-training assessment for reflection. Firstly, interns should select an experience or an event on which they would like to reflect and initially complete sections 1 to 5 of the template, which includes a reflection on what actually happened and how the intern responded and why it might have happened. Once interns have completed these initial steps in reflective practice, they should then arrange a time to discuss with the preceptor. And at this point, the preceptor can provide 2 types of feedback to the intern. The first type of feedback is how the intern handled the event or the activity. And the second type of feedback should be centered around the level of interns' reflective skills. The intern should then complete sections 6 to 8 of the template to record the outcomes of their discussion with the supervisor, including what was learnt by the intern and what could happen differently in the future. Interns also then have the opportunity to close the loop on their reflective practice in section 9 of the template, in which they can outline what might have happened when a subsequent similar event occurred in practice and how this was handled. The assessment rubric requires supervisors to determine the extent to which the intern has demonstrated reflective practice, and exemplars of reflective practice will be provided to support interns and preceptors with the implementation of this activity. In summary, I'd like to recap the key benefits that support the expansion of workplace-based assessment tools in pharmacy training. Having a framework for performance assessment in the workplace means decisions about a learner's readiness to progress to their next stage of practice and next level of supervision are more well-rounded and justifiable. And it also provides a level of consistency and equity in the way that we approach performance assessment for all interns nationwide in all practice environments. Interns are at a really important stage of transitioning to an autonomous role in practice, and importantly, these tools provide a suitable framework for providing regular feedback and performance remediation for the intern, and can also assist preceptors to adjust tasks and workload in the work environment to facilitate the development of the intern as appropriate. Lastly, the intern training year is only a part of an individual's learning trajectory in pharmacy, which ultimately begins when starting university and continues into lifelong learning and development. Students begin obtaining workplace experience and requiring supervision on the job during clinical placements as early learners. And workplace assessment tools such as the EPA framework offer utility in being able to provide continuity of support and performance assessment for preceptors at all stages of the learning trajectory. We thank the Pharmacy Board of Australia for funding this project and for working with us throughout the project period as part of the governance group. We would also like to thank the members of the Technical Working Group who assisted the project team in the development of the tools, and all the interns and preceptors who participated in the pilot. We also acknowledge the significant and extraordinary contribution of the late Dr. Erica Sainsbury, APC consultant, who led the development and drafting of the tools and supplementary material. The APC are working closely with intern training providers to roll out the workplace-based assessment tools in 2022. We will continue to gather and welcome all feedback from intern training providers, preceptors and interns over the next 12 months to inform improvements to the tools and take on board considerations for future expansion of workplace-based assessment in the pharmacy intern training year.